Dr. Bhavna Parikh, Medical Oncologist at Lilavati Hospital, Mumbai. On this occasion of World Cancer Day of 4th February, I would like to discuss few facts about lung cancer. All over the world, lung cancer is one of the common cancers that we see, and especially in the young males, this is seen as the second most common cancers as far as our country is concerned. We see more and more number of lung cancer patients in our day-to-day practice as oncologists, and even the death rates due to lung cancers are quite high. The commonest cause for lung cancer is tobacco consumption. Please remember that tobacco consumption in any form, whether it is pan masala, gutka, cigarettes, bidis, e-cigarettes, vaping or hookah, all are equally dangerous and none of them is lesser than the other. I would also like to highlight over here that the pollution is another important reason for causing lung cancer. The tobacco smoke which one smokes and inhales directly is a way of risking for the lung cancer. I must also highlight about the second-hand exposure to tobacco smoke. What do I mean by second-hand exposure? When your spouse or your family members, your co-workers, or when you're in a public place, if other people are smoking, if you inhale that smoke also, it is equally harmful and it can also lead to lung cancer. So we must realize these issues. Unfortunately, for lung cancer, we do not have any screening test available, and hence most of our patients come to us in advanced stages. Nowadays, because of the increased awareness about lung cancer, we do see patients in early stages, but that is quite less in number. When we talk about management of advanced cancer, lung cancer, apart from chemotherapy, we do have other options today like immunotherapy and targeted therapy. You all must be knowing that chemotherapy basically involves administration of anti-cancer drugs, usually intravenously. Immunotherapy is a new form of therapy which is also in the form of injection of a new class of drugs, what we called as immune checkpoint inhibitors. Your oncologist may tell you to do a particular test called as PD-L1 on your lung cancer tissue just to find out whether you can be helped by giving immunotherapy. Oncologists will also ask for some other tests, what we called as genetic test, driver mutation test on the lung cancer tissue, so as to find out whether a patient can benefit out of targeted therapies. Many of these targeted therapies are in the form of tablets, so it is quite easy to consume. Having said that, we have made a lot of progress in the management of lung cancer in advanced stages, but it still remains as an incurable disease. We all know that prevention is better than cure. So let us stop tobacco consumption in any form. Let us stop other people also from consuming tobacco, because that's the only way that you can reduce the risk of developing lung cancer. All of us should be alert and aware that we need to reduce pollution as much as that we can, just to protect our next generation from lung cancer. And at the same time, if you have any persistent symptoms of cough, breathlessness, bleeding in the sputum, weight loss, or any other systemic problem, you must take consultation from a specialist to rule out any of these critical illnesses. Thank you very much.